Benign prostatic hyperplasia, South College, nursing 5546, primary care for adults, older adults, and families 2. Dr. Hampton, October 11, 2024, by Melissa Walton. Benign prostatic hyperplasia is a condition that occurs when the prostate glands enlarge, potentially slowing or blocking the urine stream. Other names for benign prostatic hyperplasia includes benign prostatic hypertrophy, an enlarged prostate, and BPH. Benign prostatic hyperplasia incident. Globally, the case of BPH in 2019 was 11.26 estimated incidents, increasing from 5.48 million in 1990. The prevalence. BPH affects 5% to 6% of men ages 40 to 64, and 29% to 33% of those ages 65 and older. BPH is the most common prostate problem in men older than 50 years old. BPH rarely causes symptoms in men younger than age 40. Risk factors includes aging, family history, dietary factors, diabetes, heart disease, and lifestyles. Pathophysiology. The bladder outlet obstruction in men with BPH can be attributed to static and dynamic components. Static obstruction is a direct consequence of prostate enlargement and resulting in periurethral compression and bladder outlet obstruction. Prostate enlargement distorts the bladder outlet, causing urinary obstruction, while periurethral compression requires increasing voiding pressures to overcome flow resistance. Benign prostatic hyperplasia clinical presentations are frequent urination, especially at night, a hesitant, interrupted, or weak stream of urine, the need to urinate frequently, leaking, or dribbling of urine. Some men are not bothered by their symptoms, while others are bothered by them a great deal. Testing and screening includes a rectal examination. Your doctor or nurse will need to perform a rectal examination to feel the size and shape of the prostate gland. A rectal examination can help to determine if there are signs of prostate cancer. A urinalysis. You might be asked for a urine sample to see if you have bladder infection, diabetes, or kidney stones. A blood test. A blood test is to check the prostate specific antigen PSA level is often recommended. The PSA is a protein produced by the prostate cells. The PSA level may be increased in men with BPH. Treatment. Treatment options include lifestyle changes, medicines, and surgery. Lifestyle changes include stop drinking fluids a few hours before bedtime or going out. Avoid or drink less fluids that can make you go more often, like caffeine and alcoholic beverages. Double void. Double void means that after you empty your bladder, you wait a moment and try to go again. Do not strain or push to empty. Medications. Medications includes alpha blockers, such as Flomax, alpha reduced inhibitors, such as Proscar, and transurethral procedures, resection of the prostate, ablation of the prostate, plasma vaporization, laser ablation, incision of the prostate, water vapor thermal therapy, prostatic lift, removal of the prostate, or having a suprapubic catheter placed. Patient education. Patient education should include educating the patients to drink less at night, limit the caffeine and alcohol, go when you first feel the urge to avoid, be physically active, empty your bladder completely when you have to urinate, plan your bathroom trips, use the bathroom often and don't try to hold urine for long periods of time, limiting decongestants or antihistamines, avoid or monitor your use of medicines that can make BPH symptoms worse, and staying warm. Reflections. Doing the research to create the flowchart gave me a better understanding of the disease process as such as the pathophysiology, the prevalence, symptoms, differential diagnoses, diagnose, the management, possible complications, and patient education. Challenges included formatting the flowchart and finding peer-reviewed articles to obtain reliable, accurate data. Strategies that was used included organizing the flow of the flowchart, picking a symbol to use, and maintaining a directional flow. For reliability of sources, I utilized academic databases. The next page is my reference page where I obtain my information from. Feel free to read it at your leisure. Thank you.